ratios, it's like a fraction. When the upper number is high and the lower number is low, in this case, when the nurses are many and the patients are few, then it's a good thing. But when the number of nurses is low and the patients are many, that's not a good thing. That's why, when you are a nurse, you learn how to deal with the workload. It is sometimes overwhelming, because when you go there is not a manual that you read to direct you on what to do every day. So you have to learn to do your work and do it efficiently. Almost every day nurses who work the day shift hit the ground running because of that. There are so many things they have to do, and they have so many things to accomplish during the day. That's why it's important that states set up legislation that addresses the workload for nurses. And in 2004, California became the first state to implement minimum nurse-patient staffing ratios. But these ratios are not everywhere. Actually, institutions in other states do it the way they want. You can go to the floor and they give you about 20 patients or 30 even, because there is no legislature to control that. You as my audience, you need to know this information because it affects you. Can you imagine going to hospital and your nurse has 20 other residents to take care of? When will they have time to take care of you? So you need to know this so that we can address this. Maybe you will talk to the senator. I might have to talk to somebody, to make sure that this is taken care of. The reason I chose this topic is because I'm a nurse myself, and I know what many nurses go through on a daily basis. The nurses might want to take care of you very well, but due to the workload, they cannot. They would rather give you medication to keep you comfortable, because, they don't have that time. So they'll give you medication, which might not be good for you, by the way. In a study, participants agreed that the main impact on heavy workload is the lack of social interaction with their patients. Nurses have to set priorities, and interacting with patients is not one of them. How will nurses know how their patients are doing if they are not interacting with them in the first place? You see the dilemma that I'm talking about? In another study, fewer hospital-acquired infections were related to high nurse-to-patient ratios. I'll explain that. That means higher hospital-acquired infections were related to low nurse-to-patient ratios. In places where the nurse-to-patient ratios were high, there were less infections because the nurses get time to wash their hands, to put on gloves, to do everything possible to make sure they take care of their patients. But in places where the nurses were few, guess what? These people didn't wash their hands, maybe they didn't even put on gloves, maybe, they caused a lot of infections. Do you want to go to hospital and get an infection yourself? Of course not. Not only do low nurse-to-patient ratios affect patients, they affect the nurses too. Nurses become overwhelmed and stressed and may end up in the hospital too, decreasing the nurse workforce and increasing the number of patients. So the nurses themselves will end up sick and then in hospital, or they'll take time off from work, which is not good. We have talked about high nurse to patient ratios being important, but sometimes the facilities are pushed in a corner whereby they cannot get enough staffing. You know, clearing nurses from foreign countries through the USA immigration process is hard and can take years. There are very few nurse training facilities in USA, and getting into nursing school is so competitive. Ask me if you want to know that. Okay, nurse entrance exams are also too hard. I wish they could make them easier. And you have to be crime-free, you know, to get into nursing school. So many people, you know, have committed crime here and there. It doesn't matter whether it's a misdemeanor or not. You'll not go to nursing school when you have a crime in on your background check. Although medical facilities may be pushed to the limits due to the scarcity of nurses and them trying to save money, sometimes something has to be done to increase the number of nurses. The process of getting nurses from foreign countries could be made easier. That's one option. States should build more nursing training facilities. That's another idea. Then states should make nursing entrance exams easier than they are now. It doesn't mean that it depends on the way you are training your nurses. It doesn't need to be very hard. You know, an exam can be easy, but the nurses that are who are coming out of the institutions might do even better than the ones who passed a very hard exam. Legislation should be in place to control nurse to patient ratios in all states. You know, California is doing it, so other states can do it too. Okay, medical facilities should do whatever possible to increase their nurse to patient ratios. As we have seen, this will decrease mortality rate. It will decrease the spread of hospital-acquired infections. It will help in the rescue of patients who need to be rescued. With that, I mean, you know, if a patient has signs and symptoms that they are like maybe having a heart attack, the nurses might be too busy, you know, doing other work and might not be able to see this patient who needs to be rescued. So the patient might end up dying, you know. Implementing legislation in this effect, like California did, and also building nurse training facilities and getting nurses from other countries. There are so many people in other countries who are willing to come to America to work as nurses, but they can't do that. And those are my references. Impact of nurse-patient ratios, implications to the California nurse staffing mandate for other states. And then I have understaffing, overcrowding, inappropriate nurse to ventilated patient ratio, and nosocomial infections. With nosocomial infections, they mean hospital-acquired infections. Then the last one is predictors of burnout, work engagement, and